Well, we're absolutely delighted that the work has been recognized. It's amazing. And actually, considering how important the project was in terms of shifting the momentum in terms of golf participation, it's so nice to have actually had some form of recognition for it. Uh, Obviously, a lot of hard work was done, much less by me, I have to confess, actually, much more by Roger and Andrew, who did the heavy lifting. Obviously, I was very much involved in the early stages of the project and so on, and was on the board, but there were a lot of hard work done, and particularly by Roger and Andrew. And we're so happy that it's been well received, by all the various golfing authorities and the national bodies. And we hope that this will be the stepping stone for more good things to follow, basically. So I think the one or two key things I think that have come out of the study is the fact that golf has gone from being what was considered to be a hobby or a recreational thing to being considered to be a health-enhancing activity or sport, if you want to call it that. And it took quite a while to do that. We needed data, and this data has now been validated in very bona fide journals. So we've got the scientific background now to be able to say that. And we've already begun to have impact on people and their attitudes towards golf. So, for example, it's now very much become a cornerstone of how the RNA are going to actually drive golf participation across the board in all their different regions. They are very much pushing it towards the national golf federations and the golfing bodies to make sure they use the health benefit of golf as one of the tools in trying to help to expand golf participation within their regions and their countries. And from my point of view, the most important step, I think, has been the fact that the World Health Organization, which never really considered golf to be an important and a health-enhancing activity, now recognizes it formally as that. And that gives us a lot of validation right across the board, particularly in the geopolitical sphere, when it comes to things like ministries of sport and government making national decisions about their health strategy. It's important that we've got this off the ground and keeping it going forward. And there's more research to come. Well, I think the golfing unions and golf bodies or whatever and the big organizations are going to do what they're going to do. But hopefully, if this is filtering its way into social and media platforms, then I think it can start right from the from the ground level up, really. It can certainly be one of the things that individual golf clubs or golf institutions can push for. For example, even local driving ranges, they can have, taster sessions or whatever. They can use their health, benefits to try and push for that. And local authorities, I don't know how it works in other countries, but certainly local authorities in the UK are required to promote health at the regional level, at the county level. And some of those county officers that are responsible for organizing sport and health benefit, they can start using some in their messaging too. So it goes right across the board, not just at the national and international level, but even at the national and regional level. So, I'm involved with Edgar anyway, so it's been something that's been very close to me. But having already established the fact that enable individuals that golf can be a health-enhancing pursuit, then golf in disabled golfers is an important thing to start to get on top of, because these people are less mobile, less active, and therefore more predisposed to risks related to immobility. So the fact that golf will allow them to participate in that setting and have a career algorithm for getting better. This is where, PGA coaching will need. But the thing is, we'll have to give them the tools to be able to do that. So PGA coaching will have to upscale to incorporate people with disability, being able to have taster sessions and then improving and so on and so forth. So I see a great opportunity, basically, with this going forward. Well, I think it's going to keep going. And I think that, the golfing federation, the golfing bodies, national golfing bodies, whatever, they are now beginning to get the messaging into their golf development programs at the international level. And that's particularly true in countries where some of the metabolic consequences have impact. For example, Southern Asia, Southeast Asia, and so on. Some of the newer golfing regions, if you like. And I think that there's a great opportunity to get better participation and engagement in those countries if the health side of it is basically intertwined with the development side.